O positive. O positive red blood cells can be given to anyone who is Rh positive. This means people with blood types A positive, B positive, AB positive, and O positive. Most people are Rh positive, so O positive blood helps many patients. In emergencies, doctors can use O positive quickly, and that can save lives. O positive blood is common, and hospitals can usually find it easily. That means shorter wait times for surgeries, accidents, and childbirth care. Type O blood has no A or B markers on its red cells. A malaria parasite can make red cells stick together, but with type O blood, this sticking is less likely. That may mean milder cases of malaria. People with type O often have slightly lower levels of two clotting proteins. This can reduce the risk of harmful blood clots over a lifetime, though it may also mean a bit more bleeding in some cases. Studies link type O with a lower risk of pancreatic cancer. Type O blood also tends to have lower levels of sticky and inflamed signals in the blood, a small plus for heart health. Long ago, people with type O blood faced many different kinds of infections. The simpler O surface may have helped their bodies recognize new germs more easily. In families or communities where most people are Rh positive, having one O positive donor nearby can be extremely valuable, especially in urgent situations. A positive patients can get red cells from A positive and O positive. They can also get A negative and O negative if needed. This gives doctors many safe choices. A positive is common, so help is usually fast in emergencies. About 3 in 10 people are A positive. Because it is common, hospitals keep a lot of A positive. This means fewer delays for surgery, injuries, and birth care. Long ago, when towns got crowded, germs spread more. The A marker helped the body notice some bacteria better. That was useful when cleaning and water were poor. People with A often have a bit more of two clotting proteins. In a cut or during surgery, this can help clots form faster. Bleeding may stop sooner. A cells cover the H marker that some gut germs like to grab. So, compared with type O, A positive people may have lower risk of the worst forms of some stomach bugs, like cholera and some norovirus. In places where A positive is common, a match is easy to find. Family or local donors often can help quickly and safely. B positive. B positive patients can get red cells from B positive and O positive. They can also get B negative and O negative if needed. This gives doctors more than one safe choice in a rush. B positive is less common than O positive and A positive, but hospitals stock O positive for many people and B positive for group needs. So B positive patients can often get blood fast, with fewer delays than rarer Rh negative types. People with B, non-O, often have a bit more of two clotting proteins. In injuries or surgery, clots can form faster. This can help stop bleeding sooner. B is more common in parts of Asia and the Middle East. Long ago, local germs and living conditions likely favored the B marker there. The B marker can change how some germs stick to cells. This can lower risk from some bugs and raise it for others. It is a trade-off that helped B stay in those areas. Some studies link Group B with small differences in sugar and fat handling. AB positive. AB positive patients can get red cells from any type, OAB or AB. They can get Rh positive or Rh negative. In a rush, this removes wait time and helps care start fast. AB plasma has no anti-A or anti-B, so AB donors can give plasma to people of any ABO type. This is very helpful in big bleeds and burn care. Platelets from AB donors carry little A or B antibodies, so AB platelets fit many patients. This eases matching for surgery and cancer care. Because any red cell type works, AB positive patients are least likely to face delays from shortages. This helps for planned and emergency care. Like other non-O groups, AB positive people often have a bit more of two clotting proteins. During bleeding, this can help clots form faster. AB mixes A and B markers. Studying AB donors teaches doctors about blood safety and how bodies and germs interact. That helps all groups. O negative. O negative red cells have no A, B, or RhD markers. Doctors can give O negative to anyone when the exact type is not known. In crashes, disasters, and field care, O negative lets teams start fast. Using O negative protects people who are RhD negative. It helps prevent anti-D, which can harm future pregnancies. This is why O negative is key for girls and women who may have babies later. Doctors often pick O negative, especially CMV negative units, for newborns, and some babies before birth. It lowers the risk of bad reactions in early life. With no A, B, or D targets, the chance of a sudden mismatch reaction is lower. This makes quick choices safer when a patient's history is unknown. Hospitals keep an O-negative reserve as a safety buffer. One stock can cover many patients while the lab finds exact matches. Like type O in general, O-negative people often have a bit less of two clotting proteins. Over life, this links to a lower risk of harmful blood clots. There can be a small trade-off of more bleeding in some cases. A negative red cells can go to a negative, A positive, AB negative, and AB positive patients. So one A negative unit can help both Rh negative and Rh positive people in the A and AB groups. That is strong help for many cases. The A marker covers the H marker. Some gut germs like H with A, there is less for those germs to grab. So compared with type O, the worst stomach bugs, like cholera and some norovirus, may hit less hard. People with A, non-O, often have a bit more of two clotting proteins. In a cut or in surgery, clots can form faster. Bleeding may stop sooner. Hospitals protect Rh negative supply. They try to keep A negative on hand for people who must stay Rh negative. This includes girls and women who may have babies, and people with anti-D. That means A negative families may get fast, right type help. Long ago, when people lived close together, some bacteria spread easily. The A marker helped the body spot some of those germs better. That likely gave a survival boost. B negative red cells have the B marker, but no RhD. They can go to B negative, B positive, AB negative, and AB positive patients. So one B negative unit can help 4 groups. This is big help because B negative is rare. B negative patients can only get B negative or O negative. Rh negative blood is limited. Hospitals protect it for trauma, surgery, and birth care. This helps B negative patients and their families get the right type fast. If the patient is Rh negative, using B negative avoids the D marker. This lowers the chance of anti-D. That protects future pregnancies. People with B, non-O, often have a bit more of two clotting proteins. In bleeding, clots can form faster. Sometimes this means fewer units are needed. B is more common in parts of Asia and the Middle East. Long ago, local germs and diets shaped this. The B marker can change how some bugs stick to cells. It may lower risk from some germs and raise it for others. This trade-off helped B stay in those places. It can go to B and AB patients who need Rh negative. So B negative stock is a high-value buffer in shortages. AB negative. A B negative plasma has no anti-A or anti-B. So AB negative plasma can go to anyone. This is very useful in big bleeds, burns, and trauma. Platelets keep some donor plasma. AB-negative platelets have almost no A or B antibodies, so they fit many patients fast. AB red cells can only go to AB patients, but AB-negative units can help AB-negative and AB-positive. Since AB types are rare, each AB-negative unit is precious. Like other non-O groups, AB-negative people often have a bit more of two clotting proteins. During bleeding, clots can form faster. Sometimes this means fewer units are needed. A and B markers cover the H marker. Some gut germs, like H, with A and B on top, there is less to grab. So the worst forms of some bugs, like cholera and some norovirus, may hit less hard than in type O. AB negative is very rare, less than 1 in 200 in many places. Hospitals save AB negative, especially plasma, for the toughest cases. This can mean faster help when the exact match is needed. AB is the newest ABO type. AB negative also lacks RhD. Studying AB negative teaches doctors about blood safety and immune reactions. This learning helps all blood groups.